Hi, I'm Steve Pleich, and I'll be your host for this month's edition of Nonprofit Spotlight. Nonprofit Spotlight is a production of the Volunteer Advisory Committee here at CTV, and each month we spotlight a nonprofit in our community doing really great work. This month we'll be talking about oral health access, Dientes Community Dental, and the First Tooth First Birthday campaign. I'm really pleased today to have with me some folks who are working in this area who've done a lot of great work in developing all of this and providing these services. Welcome Javier Carrillo, your Health Programs Manager for Central California Alliance for Health. Welcome, Javier.
Thank you, Steve.
Yes. Dr. Sepideh Walthard, who's the Dental Director for Dientes Community Dental. Welcome, Sepideh.
Thank you. Thanks for having me.
And Dave Brody. Dave is the Executive Director for First Five Santa Cruz County. Dave, welcome.
Hi, Steve. Thanks for having us.
Javier, let's start with you. Tell us a little bit about your role as Health Programs Manager and what your mission is for the Central California Alliance for Health.
Sure. So my name is Javier Carrillo. I'm the Health Programs Manager at Central California Alliance for Health. Central California Alliance for Health, or the Alliance, is a nonprofit managed care plan. We manage Medi-Cal members within our Tri-County area. That includes Santa Cruz County, Merced, and Monterey counties. So we currently insure about a total of 350,000 members in that Tri-County area. And our mission is primarily to provide accessible, quality healthcare, which is guided by local innovation and connecting our patients with our primary care providers and also with hospitals and specialists. So my role as the Health Programs Manager is to primarily oversee the health education and disease management programs, which include, working with individuals that have diabetes, asthma. We are also working with pregnant women. We're also ensuring that they receive access or early prenatal care during their pregnancy. And we also work with those individuals postpartum. We have programs that are geared to fight the obesity epidemic that we have within our nation and worldwide with implementing their various programs. One is the Healthy Way for Life program, which is primarily targeting children between the ages of 2 to 18 years of age who are overweight or obese. This is by PCP referral or primary care primary referral. In addition to that, we also manage our cultural and linguistic services program, making sure that the services that we provide to our Medi-Cal members and other lines of business are culturally and linguistically appropriate, ensuring that we provide interpreting services at all points of contact within the primary care doctors, but also ensuring that the materials that we provide to our members are culturally and linguistically appropriate for the population.
Well, that's a wonderfully comprehensive range of services you're providing. So that's really great information for our viewers, and actually for me, I'm very fascinated by that. Dr. Sepideh Walthard, okay if I call you Sepideh?
Sure.
Okay, you're the Dental Director for Dientes Community Dental. Tell us a little bit about your work with Dientes, and a little bit about Dientes itself as a nonprofit giving us oral care access.
Sure. As the Dental Director, my job is to oversee all the clinical aspects of our care and also to monitor the quality of our care. Dientes is a nonprofit dental clinic, and our mission is to provide the low-income members of our community with everlasting oral health. We have a 15-chair dental clinic in Santa Cruz, a 4-chair clinic in Watsonville, and we also have an outreach program that goes to schools, skilled nursing facilities, and also we have a chair at the Homeless Services Center. So our main purpose is to serve those people who don't have anywhere else to go when it comes to dental care.
And that's terrific. I think anybody who knows anything about health services and the health services that are provided in our city and county knows of Dientes and knows of their wonderful work. So really, thank you so much for being here. And we want to talk more about some of your programs as we go along. Dave Brody, welcome. How are you? Good to see you again. You're the executive director, of course, of First Five Santa Cruz. Tell us a little bit about your work with First Five and just kind of a snapshot of their mission.
Sure. So First Five is an independent public commission in Santa Cruz County. We are funded to essentially support the healthy development of all kids age 0 through 5, really prenatal through 5. We do that either by funding programs or directly operating programs in 3 core areas. First, early learning. We do a lot of work around early literacy and quality early learning environments. Second, through family support. We fund and support a lot of programming around positive parenting and supporting mitigating risk of maltreatment in our community. And then in health. And we've focused in the health area a lot on, historically, on health insurance and ensuring that all kids in our community, in particular 0 through 5, have access and have health insurance, but also access to care. And that's the relationship and the connection to what we're talking about today.
Well, it's interesting as you were saying that I'm thinking about the connection between early childhood cognition and, as we were talking about here, early childhood dentition, which is so important. We have a great roll-in that we did showing some of the folks over at Dientes and give you just kind of again, a snapshot of the work they're doing over there and the folks who are doing the work. Then we'll come back and we'll talk about one of their programs. Let's see it now.
Hi, my name is Eva Maria, and I'm a DA here at Dientes. I like working with our staff. We're a good team. I like working more in the pedo side. I like being involved with the little kids, teaching them how to brush their teeth very well. Doing the flossing is a really important key. We like to work more with the tiny ones now, teaching them how to get used to us, not be scared of us. More so we can prevent them from getting any type of treatment now that they're younger.
My name is Noemi and I'm a scheduling coordinator here at Dientes Community Dental. What I like best about working at Dientes is that we're able to serve people who would, if we weren't here, there would be no other way for them to be seen elsewhere.
My name is Denise Monroy and I am a pediatric dentist here at Dientes Community Dental. I specialize in the dental needs of children and teenagers. I love working at Dientes and working with people that are truly passionate about serving those that are in need, and love seeing how committed everyone is to serving those in this area that are underserved.
My name is Lupe Ortiz, and at the moment I am a dental assistant. And what I like the most is I like to do outreach and we go to various locations. But my favorite thing is probably Tiny Teeth Tuesday, and I have many reasons why it's my favorite. So one of them is because we get to go and we get to do preventative work. So we educate patients and parents about oral hygiene, and we get to talk about prevention methods as far as brushing and how to use fluoride. And the best part is that we are able to go to their medical home. So we go to these patients just that way when they get a little bit older, we don't have to hopefully see them here as often for treatment. Hopefully we can teach them preventative ways to take care of their teeth and how to brush and how to floss properly. So Tiny Teeth Tuesday is definitely my favorite out of outreach.
Hi, my name is Claudia. I'm an RDA here at Dientes Community Dental. What I like about Dientes is that we go to outreach and we get to do cleanings on children from kinder to 5th grade. We get to teach them about taking care of their teeth at home and sending them report cards so they know how they're doing. Also, we get to give them a good experience about having their teeth worked on and making them trust us.
I think it's very important that children are seen here by their first birthday, because when we see patients who are younger, you notice a difference that, there's no decay and, they're healthier. And when they come in and when they're older and they have never been seen, a lot of times they have more problems with their teeth.
A visit to the pediatric dentist is usually a child's first exposure to dentistry, and I like that we can make that a positive experience both for children and parents. It is very important for a child to visit the dentist either by the time they have their first tooth or at least by their first birthday. It can have an impact on not only a child's primary teeth or baby teeth, but also how their adult teeth will form in the future.
And that's a great snapshot of Dientes, and not only talking about some of the services provided, but also you get a feeling for that wonderfully welcoming atmosphere that you've generated over there. And of course, they mentioned the first birthday campaign, which we'd like to talk about. But let's talk for a minute about the Oral Health Access and Steering Committee and Strategic Plan, and how this campaign generated out of that, and your collaboration within that. Javier?
So I think the whole idea of getting a group of individuals together is to come together and talk about some of the issues that are impacting our community in terms of oral health, in terms of access. Do we have enough dental providers within our county that can provide, the services that are needed for our community? Knowing that there is about 80,000 covered individuals by Medi-Cal, but only about 25,000 of those individuals have been to a dentist. So we saw the need. There is a need for us to come together and talk about some of the strategies that we can all work together to be able to bridge the gap that exists in terms of access to oral health within our community.
And Dave, you are also collaborating in this strategic plan and steering committee?
Yeah, that's right. And just to recognize that Dientes really is the champion of the Oral Health Access Steering Committee, and the work that's happened in organizing all of us around this effort. So we're very grateful to Dientes for really more than a year plus of work that's been going on to illuminate this key issue around oral health care in our community. For us, from a 0 to 5 perspective, we know that oral health, dental disease, is the #1 chronic disease with children, the most common chronic disease, yet it's entirely preventable. So, first 5, right, we're focusing on young kids, and we do that from a prevention perspective. So getting ahead of that and addressing what we can to circumvent that and make it no longer the #1 chronic disease is for us what this is all about.
And Sepideh, you're also a collaborator in this development of the First Tooth, First Birthday campaign and this kind of entire area providing early childhood dentition.
Yeah, it's recommended by dental and medical experts that a child sees a dentist by the time they're 1 or by the time they have their first tooth. When they come in at such an early age, we can provide the parents with education. For example, we can tell them, don't put your baby to sleep with a bottle of milk or formula. We can show them how to take care of the baby's teeth. And we can also apply fluoride varnish, which can reduce rate of tooth decay. Unfortunately, what we're seeing in our clinics now is that kids are not coming to us until they're 4 or 5. And this fact was reflected in a study that we did. Only 30% of 0 to 3-year-olds on Medi-Cal saw a dentist. So we really need to work on that. When they come in when they're 4 or 5, sometimes it's too late. They have a mouthful of decay. They require multiple visits for treatment, and some of them have to even be sedated. So
it's
we're trying to prevent that.
Yeah, it's fascinating to me that there was so much emphasis on affordable care and medical insurance. The secondary concern seems to be dental care and dental insurance. You don't hear people talk about that as much, and yet it seems to be a concern for working class people who are getting the insurance for their children and want to make sure that as they get to be in their formative years, they're getting good dentition. So tell us a little bit about the First Birthday, First Tooth campaign. This is wonderful, a wonderful idea, a great name, a great way to reference it. People think about, gosh, that sounds fantastic. How do I get involved? To give us some more details about that. Anybody can start.
Well, just before we go there, I'd just like to make the connecting point that as important as oral health is, it's actually more than that. Because what we know and what I've learned through the work on the Oral Health Access Committee is that your oral health has a direct connection to your overall physical health and well-being. We know, and it's very well established in the science, that there's a direct relationship between oral health and chronic disease later in life.
Interesting.
Just one example, cardiovascular disease, which was stunning the first time I learned
Yeah.
that. We also know, and Dr. Walthard helped me understand this, and this is pertinent to First Five in particular, that there's a relationship between oral health and dental disease and preterm births and low birth weight. Right? So this is something, another example of how by addressing basic health of the mouth, which is so important, we actually are going to have this long-term benefit in a whole range of areas related to health. And then specific to First Five and our mission, we're really focused on ensuring that kids are able to be successful as readers, in particular, as they enter school. And in particular, that they're reading at grade level in third grade. How do we traditionally do that? We focus on supporting what we call emergent or early literacy skill development in those pre-K years. Right. But what we know is that kids with dental disease are 3 times less likely to show up to school than kids without, because they just have simple tooth pain. And, all we do around ensuring that they know their letters and know how to rhyme and have those basic emergent literacy skills when they enter kindergarten, are going to be for naught if they simply aren't showing up at school. So again, it's just a really most basic thing we can do to support their oral health, which has all sorts of implications for their long-term health. And so the Oral Health Access Steering Committee that Dientes organized after a significant process of both a study that was commissioned, that, by the way, actually from another point of interest for First Five, through that study, we found out that about a quarter of all our pre-K age kids in this county, and that's of all incomes, suffer from untreated dental disease.
That's amazing.
Think about that. It was stunning to me when I heard it. Just pick out 4 kids in the park at the mall.
Right.
One of those kids actually has decay, has disease happening in their mouth right now, which has all these long-term implications we've been talking about, not to mention just their quality of life right at this moment. So anyway, through this work, the study that was commissioned through the Oral Health Access, we identified 3 strategies. And of course, there could have been a lot more, but I really commend Dientes again for being focused. Right. And one of those was First Tooth, First Birthday. And maybe before we go into that, I thought it might be helpful if we talked about the other components of the strategies.
So besides First Tooth, First Birthday, the second recommendation was to make kindergarten or first grade dental screenings mandatory in Santa Cruz County.
And this came out of the steering committee and strategic plan that you're
this
developing?
was a law that went into effect a few years ago, but unfortunately it became optional because of loss of funding at the state level. So some of the schools were doing it, some weren't doing it. So I'm really happy to say as of this coming school year, 2017-2018, all Santa Cruz County schools require that a child has a dental checkup before they enter public school for the first time. And that really matters because they can establish a dental home, they can get their treatment done, they can have a healthy mouth and then come to school and be more successful, not have pain or infection or not miss school days.
And as a practical matter, how does that interface between the school and Dientes, for instance, come into being? How does that happen?
We had members of, we had Michael Watkins from the Office of Education.
Absolutely. We've had Michael
on the steering committee.
Oh, wonderful.
Yes.
Yeah.
So he agreed to help us. And the 2 community clinics in our area, Dientes and Salud para la Gente, we have committed to fitting these children into our schedule to make sure that they get what they need to have done before they enter public school.
And is that also part of your outreach into schools, is to make them aware that these services are available and it's part of a program?
Yes. Yeah. And the third goal of our strategic plan is to expand capacity. When it comes to dental care, one of the biggest problems is not having enough capacity for these patients on Medi-Cal or patients without insurance to be seen. Yeah. So private dental practices are not accepting Medi-Cal patients.
Oh, I didn't know.
There are only 10 in our area that take Medi-Cal patients, and a lot of them are not accepting new patients. So, for example, at Dientes, we get calls every day of people wanting to be new patients, but we have to limit how many people we can take because we won't be able to finish treatment plans if we take an unlimited number of new patients. So capacity is a major problem. And the third recommendation focuses on expanding capacity.
And your present capacity, do you have a long waiting list for the clients that want to come in?
We do. For new patients, we do have a long waiting list, yes.
But they've placed a priority on kids related to this
right.
campaign.
That's wonderful, of course.
We've ensured that children between 0 to 3 or kids that need to get their school dental checkups done, we get them in immediately.
And Javier, what part does the the Central Coast Alliance for Health play in this?
So the Alliance role primarily is to be able to support some of the efforts that we're going to be implementing coming this year and following subsequent years. Right. Primarily because we have an audience that we can easily reach out to when it comes to increasing awareness about oral health, not just for the baby, but also how important it is for the mother when she's pregnant to make sure that she has good oral health because of the implications that can happen if the mother. So we have an early prenatal care program that we can potentially reach out a lot of pregnant women and encouraging them to receive oral health during pregnancy, but also postpartum, reaching out to those new moms that have given a birth, and encouraging them to start, oral health early from the beginning, especially at the first birthday or first tooth.
Right. And so this First Tooth, First Birthday campaign, I thought it was important to set up is in the context of this broader effort. So we recognize we need to increase access capacity, right? More dental chairs, so to speak, doing work in our schools. But then this important work, and most, from our perspective, the most important that we can do with our youngest kids, right? Right. So this basic concept of see a dentist by the time your kid's first tooth emerges or their first birthday. And I think as Dr. Walthard said, it's really just fundamentally about establishing a dental home, a relationship with oral health care for your family, and getting basic prevention messages, as well as a basic checkup and some prevention work can actually be done in the mouth.
I think, it's an important, I think, to also establish a dental home, as you say, with which one is comfortable.
Exactly.
And it seems like, Dientes is really that place, that focal center for that, where you can be comfortable in beginning this program, beginning this very early program.
Exactly.
Yeah, because when you bring them at such a young age, it's a lot easier for them to get used to it. And then if you're doing preventive work versus doing treatment, which can be more traumatizing, then it's a lot easier for them to continue to come in for their exams, checkups, cleanings, fluoride, and hopefully they'll never have a cavity.
That's right.
Well, and it's a wonderful ethic to establish very early that, to see the dentist is a good thing. To see the dentist is a pleasurable experience. It's good for you.
That's exactly right.
Yeah.
That's exactly
It kind of plants that seed in your mind. It's wonderful.
Right. Yeah, we learned from a study in Sacramento, actually, that our partner organization, First Five, commissioned there, that one of the number one barriers to kids getting into oral health care, beyond some of the stuff we've already talked about, is fear.
Yeah.
Right. It's parental fear in particular. Right. And so
interesting.
A big part of our work is just delivering the message that there's nothing to be afraid of.
Right.
The earlier you get in, the less there is to be afraid of. And dental oral health care for kids with pediatric dentistry today looks nothing like what it looked like 20, 30 years ago,
imagine,
or even 10 years ago. It's a completely different experience, and it's a place that kids can really feel at home and welcome, and and feel successful in keeping a healthy teeth and a healthy mouth.
Well, it's interesting to me on the roll end where the young woman was identified as a pediatric dentist.
Exactly.
And so I'm going, my gosh, how often have we heard that, and what relationship does that have to our really wanting to have our very, very young people get into a dental program as they start out their very formative years. Wonderful.
Exactly.
And it's interesting, Dave, I just wanted to say that I was at UCSC a while back and got an early childhood education certification and there they were studying early childhood cognition, but the relationship between early childhood cognition and early childhood dentition that you're making is a fascinating link to me that I really hadn't considered.
Yeah. I mean, when you step back and think, it makes sense, right? That the health of the body is connected to the health of the mind. We know that fundamentally. And the health of the mouth is fundamentally connected to the health of the whole body, right? So, and again, like I said earlier, the number one chronic disease in children, completely preventable. And so that's what First Tooth, First Birthday, again, is all about, is just getting basic messaging out to our community, connect with your oral health care provider, do the things that are necessary to prevent chronic disease in the mouth and beyond later in life.
And I think it's also important because, I mean, you mentioned earlier today about, school absenteeism. If a kid is experiencing tooth pain, I mean,
absolutely.
It's going to
think about that. How distracting that could be when you're trying to concentrate on your studies or something.
Yeah. I mean, for us, and I think for all the organizations at the table, this is fundamentally an equity issue. Our kids deserve the opportunity to have a healthy mouth.
Right.
They deserve the opportunity to have a healthy body. They deserve the opportunity to succeed in school. Right. That's what we're fundamentally all about as organizations. And this is just really a very straightforward way that we can support that effort.
And I think that's kind of the watchword for people that I know about First Five, generally speaking, is they want to have kids get an opportunity early to succeed.
Right.
To set success up early.
Up for success. Yeah.
But we've got another 2, 3, 4 minutes. Let's talk about kind of the future of this campaign and how we're going to be able to really provide more access and more capacity through not only this campaign, but generally speaking about to all children.
Sure. Well, I would first with First Tooth, First Birthday, just a couple things we haven't talked about. First Five operates something called Baby Gateway, which is a program where we make contact with every newborn, every new mom in the county, all 3 birthing hospitals every year. So it's this tremendous channel. We provide basic education. We help ensure that their kids are enrolled in health insurance. They've established a primary care provider, that they have a well child checkup set up. So we're just going to fold this right in. A basic oral health message, First Tooth, First Birthday, and we're going to we're going to essentially inject this educational material right into that existing channel that's really interacting with thousands of new moms every year in the county.
Wonderful.
So it's a really basic but I think substantial thing that we can do. You combine that with what Javier mentioned earlier, just the enormous opportunity that they have in the Alliance with their health education to get this message out.
Exactly.
And we're also reaching out to medical providers, to pediatricians. We're going to be sending them messaging saying, refer your young patients to us, tell them about oral health, educate them, and hopefully we can reach some patients through that.
Well, there's a tremendous amount of information, and of course this program being evergreen will be broadcast many times over the next few months. I urge our viewing audience, when we see this, to really see it more than once or twice, because there's been so much information you've provided to us and to me through this half hour that we've had, and we're coming to the end of it now. It's just fascinating to me that this great work is being done, and people should know more about it. So I wish we had more time, but we really have to kind of wrap up. Javier Carrillo, thank you so much for being here. Wonderful meeting you.
My pleasure.
Sepideh Walthard, Doctor, wonderful having you here.
Thank you
and
for
thank
having
you for
us.
all your great work. And Dave, always a pleasure having you here.
Thanks for the opportunity to get the message out.
Yeah, and thank you for being here. This has been really one of our most informative programs we've had, and really the mission of the Nonprofit Spotlight is to do things like this, to let our community know what great work's being done and how they can really help their children get that start to a successful life.
That's
so,
right.
Thanks for stopping by here with us this month. Tune in next month to Nonprofit Spotlight, where we'll have another wonderful community nonprofit. I've been Steve Pleich, and we'll see you next time. Gosh, that's fantastic.
Thank you.
This is great.